Hi, I'm Dr. Michael Steinberg, Medical Director of Cardiothoracic Surgery here at Memorial Hospital in South Bend.
Hi, I'm Shakir Aslam, one of the interventional cardiologists with Memorial Advanced Cardiovascular Institute. I think, as I said, over the last few years, a lot of things have changed. The criteria for surgery, criteria for medications, they have all changed. In the past, sometimes we waited too long for the patient to come to the operating room, before we did anything for them. But then it may be too late. They have developed left ventricular hypertrophy. They have developed left ventricular enlargement. Now we have fixed their valve, but they're left with all this dysfunctional heart for the rest of their life. So I think it's very appropriate to, one of the reasons patients should come to valve clinics so they can be followed along, so they can be treated at the exact time when it's needed to be treated. Because as we know, some of these patients may be completely asymptomatic with severe valve disease, so we may have to treat them and do some other testing to find out if they have some symptom which they're not, telling us, or do some kind of additional testing to find out whether the severity of the valve disease is severe enough that we should treat them before they develop any significant symptoms.
Yeah, and to reiterate that point, heart valve disease is not a one-stop fix. This is a lifelong problem, and some people need to be followed long-term. And so we don't just see a patient one time and then send them on their way. This is something that requires ongoing counseling, ongoing medical management, regardless of whether they ever have any sort of surgical intervention done. And in fact, probably, I bet half the patients that we've seen thus far in the valve clinic have been managed without any surgical intervention at all. And so it's I think, a huge bonus for primary care physicians to have a valve clinic in place that can follow these patients long-term and really optimize their heart failure management as their heart changes over the course of the years.
Yeah, I think I should also emphasize, Mike, like some of the recent trials, like PARTNER 2 trial and PARTNER 1 trial, they've shown us that some of the older patients that in the past we thought they're high risk to do any kind of surgery. And in that trial, we've seen even those older patients, they have much less risk of surgery with some of the latest technology that we have, and they did much better than patients who didn't get any treatment or didn't get any surgery. And so that might be one of the reasons to send some of those patients to the clinic, because you may think that these patients are too old and they may not need any surgery, but we might be able to evaluate them and offer them some kind of treatment, which obviously will improve their quality of life and make them live longer.
Absolutely.